According to the CDC, the rate of childhood obesity has tripled since the 1970s, as 1 in 5 children were reported to be obese in 2017 to 2018. A disproportionate percentage of racial or ethnic minorities children were affected by childhood obesity, where 25.6% of these children were Hispanic, 24.2% were Black, 16.1% were white, and 8.7% were Asian children. Childhood obesity has a large impact on national economies due to several long-term consequences, such as through reduced productivity, reduced life expectancy, increased disability, and through significantly increased healthcare cost. Moreover, low socioeconomic status children are nearly twice more likely to experience obesity than children with high socioeconomic status. In terms of the built environment, our population spends most of their time at school. However, there are variations in childhood obesity rates by different regions because not all elementary schools provide the same physical activity or nutrition curricula, and some schools foster physical activity better than others as they have more resources to promote physical activity, such as having better playgrounds, recess areas, and gym equipment. As children in elementary school get most of their lunches and snacks from the school cafeteria, their food choices are heavily dependent on the availability or options provided by the school. Research findings from focus groups investigating barriers to healthy eating habits among elementary school students have shown that the availability of fast food options and cultural or family norms were one of the main barriers to healthy food consumption.
Kids spend most of their time at school. Some kids' primary source of nutrition is school lunches, especially for low-income students. School can also be the main place where a child gets most of their physical activity. After a push for schools to dedicate more time to STEM, language arts, and state testing, schools have had less time allotted for physical activity. This causes more sedentary students, which makes them more susceptible to obesity. Moreover, school lunches are not always healthy, and efforts to make them healthier have been met with many roadblocks. As it stands now, children are not meeting nutritional recommendations in their school lunches. The Department of Agriculture has tried to pass new guidelines for meals given in schools, which would decrease sodium, trans, and saturated fats, and increase fruit, whole grains, and veggies in school lunches. The USDA has also tried to limit potatoes and other starchy vegetables in school food, and instead increase dark green, orange, and red vegetable consumption. This is because pizza and french fries, for example, are popular school lunches, but can cause significant weight gain when eaten regularly. These guidelines were never passed, and when school lunches are significantly lacking in nutritional value, kids are not meeting the recommended intake for nutrients they need and are exceeding those they should limit, which leads to childhood obesity.
Being able to provide elementary school students with healthy and nutritious meals are concerns that schools have regarding nutrition. Nutritious meals that are also appealing to children are also a concern, which is why they get input from students and their parents to see what meals would be more appealing. The USDA has put this into consideration and made rulings beginning 2022 that include flavored, low-fat milk to be served in school lunches and breakfasts. Another rule that was made effective on July 1st, 2022 was that schools would limit their sodium in lunch and breakfast meals to sodium target 1 in 2022. This means that from the grades of kindergarten through 5th grade, breakfast sodium amounts should be less than or equal to 540 milligrams and less than or equal to 1,230 milligrams for lunch meals.
There's a variety of different nutritional strategies that can be used to move our target population of elementary school kids towards a healthier dietary pattern in hopes of reducing the risk of developing obesity. Some examples of these strategies would be requiring schools to sell only low-fat or non-fat milk to children for lunch, eliminating juices being sold at school that contain added sugar and requiring schools to only sell all-natural juices, incentivize healthy eating by hosting year-long competitions in which students who regularly bring the most nutritious lunch to school will be awarded a prize of some sort, such as a free trip to Disneyland, develop a weekly program that gives one fun fact about healthy foods / healthy calories versus junk foods / junk calories, and air the program once a week during school announcements, and eliminate soda vending machines and replace the unhealthy salty snacks and snack vending machines with healthier choices such as fruit cups, sugar-free protein bars, and fiber bars.